What if your body was trying to warn you of a disaster right now, but you didn't recognize the signs? For seniors, that's exactly what happens with a stroke. Silent, sudden, and deadly. In the United States, someone has a stroke every 40 seconds. Every 3 minutes and 14 seconds. It takes a life. It is the fifth leading cause of death and the number one cause of serious long-term disability. But here's the surprising truth. Up to 80% of strokes are preventable. So why do so many people still fall victim? Because they don't know the warning signs. A stroke doesn't just steal lives. It steals speech, movement, memory, and independence. It can transform an active, healthy senior into someone who struggles with even the simplest tasks. For seniors, the danger is even greater. As the body ages, arteries can harden, blood flow slows, and conditions like high blood pressure, diabetes, and heart disease become more common. These are all silent threats, but the warning signs of a stroke don't have to be. Recognizing them can change everything. This video will guide you through the 7 early signs of stroke that every senior and their loved ones must know. Each of these signs is your body's way of sending an urgent message, an opportunity to act before it's too late. From sudden numbness to unexpected confusion, these are not just random symptoms, they are clear, life-saving signals. Don't wait until it's too late. Understanding these signs can mean the difference between a full recovery and a lifetime of disability. Stay with us, because what you are about to learn could save your life or the life of someone you love.
A stroke is a medical emergency. It occurs when the blood supply to a part of the brain is interrupted or severely reduced, depriving brain cells of oxygen and essential nutrients. Without a constant flow of blood, brain cells begin to die within minutes. This rapid cell death can lead to severe and often permanent damage if not treated immediately. In the United States, stroke is a major health concern, impacting nearly 800,000 people each year, according to the Centers for Disease Control and Prevention, CDC. There are 2 main types of stroke, each with distinct causes and effects. The most common type is ischemic stroke, accounting for approximately 87% of all cases. This type occurs when an artery supplying blood to the brain is blocked, either by a clot thrombus that forms within the blood vessel, or by an embolus, a clot that travels from another part of the body to the brain. Ischemic strokes are often associated with conditions such as high blood pressure, high cholesterol, and heart disease. The second type is hemorrhagic stroke, which is far less common but often more deadly. This type occurs when a blood vessel in the brain bursts, causing bleeding into or around the brain tissue. Hemorrhagic strokes can be triggered by high blood pressure that weakens the walls of blood vessels, aneurysms weakened, balloon-like areas of an artery, or arteriovenous malformations, abnormal tangles of blood vessels that are present at birth. When bleeding occurs, it puts pressure on surrounding brain tissue, rapidly damaging cells. Regardless of the type, the underlying problem in a stroke is the same: lack of oxygen to the brain, and when brain cells are deprived of oxygen, they begin to die almost immediately. In fact, for every minute that a stroke goes untreated, an estimated 1.9 million neurons are lost. This is why experts often say, time is brain. The faster a stroke is recognized and treated, the greater the chances of reducing its impact. But what causes a stroke? Several factors can increase the risk, especially for seniors. High blood pressure is the leading cause, directly damaging the arteries and making them more prone to blockages or ruptures. Heart disease, including conditions like atrial fibrillation, can lead to blood clots that travel to the brain. Diabetes increases the risk by damaging blood vessels throughout the body, including those in the brain. Smoking is another major contributor, as it accelerates the buildup of fatty plaques in arteries, making them narrow and prone to blockages. Lack of physical activity, obesity, excessive alcohol consumption, and an unhealthy diet can all increase stroke risk, particularly in older adults. But age alone is a significant risk factor. After age 55, the chance of having a stroke doubles with each passing decade. According to CDC statistics, nearly 3/4 of all strokes occur in people aged 65. This makes stroke prevention and early recognition especially critical for seniors. Understanding what a stroke is, how it happens, and what triggers it is the first step in preventing it. But knowing the warning signs is even more important. In the next part of this video, we will explore the 7 early signs of stroke that everyone should know, because recognizing these signs could be the difference between life and death. Recognizing the early signs of a stroke can mean the difference between life and death. For seniors, these warning signs are often mistaken for minor issues or simply ignored. But knowing these 7 symptoms can save lives. One of the most alarming signs of a stroke is a sudden loss of speech or slurred speech. This occurs because the part of the brain responsible for language, often located in the left hemisphere, becomes damaged. When blood flow is interrupted, the neurons that control language and speech begin to die, making it difficult for a person to express themselves or understand what others are saying. Imagine asking a loved one a simple question, and they suddenly cannot form words or their words come out jumbled. This is not just confusion, it's a medical emergency. Immediate action is essential. Another critical warning sign is sudden dizziness or loss of balance. This symptom occurs when the cerebellum, the area of the brain that controls balance and coordination, loses blood supply. It may start with a feeling of lightheadedness, making it hard to stand or walk. Seniors might suddenly stumble, lean to one side, or even collapse. These are not symptoms to be taken lightly, often mistaken for normal aging or fatigue. This loss of balance could be a sign that the brain is being deprived of oxygen. If you see this happen, do not assume it will pass. Seek medical help immediately. A sudden, intense headache, often described as the worst headache of my life, is another major warning sign. This is particularly characteristic of a hemorrhagic stroke, where a blood vessel in the brain bursts, causing bleeding. The pressure from the bleeding can be overwhelming, leading to severe pain. But unlike a typical headache, this pain is immediate and often accompanied by other symptoms like nausea, vision changes, or weakness. Seniors who experience such a headache should never ignore it, especially if they have risk factors like high blood pressure. Tingling, numbness, or weakness on one side of the body is another classic sign of stroke. This happens because a stroke usually affects one hemisphere of the brain, which controls the opposite side of the body. If the left side of the brain is affected, the right side of the body may become weak or even paralyzed. This numbness often starts suddenly, affecting the face, arm, or leg. For example, a senior might suddenly struggle to grip an object, or they may notice one side of their face drooping when they smile. This is not just a sign of fatigue, it is a clear signal of a medical emergency. Each of these symptoms is a cry for help from the brain. They are not just minor inconveniences, and they should never be ignored. Understanding and recognizing these signs can make all the difference. Stroke is a race against time, and the faster you act, the better the chances of a full recovery. But these are just the first 4 of the 7 critical signs that everyone should know. In the next section, we will continue exploring these signs, providing you with the knowledge you need to protect yourself and your loved ones. Stay with us, because this information can save lives. Difficulty speaking or understanding speech is one of the clearest signs of a stroke. This occurs when the area of the brain responsible for language, known as the Broca's or Wernicke's area, is affected. When blood flow to this region is interrupted, the ability to form words, understand language, or even follow simple instructions can become compromised. For some, words may come out jumbled or slurred. For others, they may seem to speak fluently, but use incorrect words, making their sentences confusing. Imagine asking a loved one their name, and they cannot answer, or they speak in a way that makes no sense. This is not simply a moment of forgetfulness. It is a medical emergency. The quickest way to test this is by asking the person to repeat a simple phrase, like "today is a sunny day." If they cannot say it clearly, call emergency services immediately. Another serious warning sign of stroke is sudden vision loss or blurriness in one or both eyes. This occurs when blood supply to the optic nerve or the visual centers of the brain is disrupted. The result can range from a sudden shadow-like effect over the field of vision to complete blindness in one eye. Some may describe it as a curtain falling over their vision, while others may see flashing lights or distorted images. This is not just an issue of needing new glasses. It is a direct signal that the brain is not receiving enough blood. Seniors who suddenly experience blurred vision or loss of sight should never dismiss it as eye strain or aging. A quick test is to ask them to cover one eye and then the other, noting any differences in vision. If one eye is significantly affected, do not hesitate. Seek emergency care immediately. Perhaps the most dramatic and frightening sign of a stroke is sudden loss of consciousness or fainting. This can happen when the brain is deprived of oxygen, leading to a complete shutdown of normal brain function. It may start with dizziness, confusion, or weakness, but can rapidly progress to full unconsciousness. This is especially dangerous for seniors, who may suffer additional injuries from a fall when they collapse. A person who suddenly faints without any clear cause, especially if they have a history of heart disease or high blood pressure, is in a life-threatening situation. When someone loses consciousness unexpectedly, it is crucial to check their breathing and pulse immediately. If they do not regain consciousness within a few seconds, call for emergency assistance and begin first aid if trained. Each of these symptoms is a critical warning signal. They are the brain's way of telling you that something is going terribly wrong. And while these symptoms can vary in intensity, they all share one thing in common. They are emergencies. Recognizing them quickly can mean the difference between a full recovery and a lifetime of disability. Understanding these signs is not just useful information. It is life-saving knowledge.
When it comes to stroke, every second counts. That's why having a quick and reliable method to recognize the signs can be the difference between life and death. One of the most effective methods for identifying a stroke quickly is the SAMU method, a simple four-step approach designed to help anyone spot the warning signs of a stroke without any medical training. This method is recommended by health organizations, including the American Stroke Association, for its simplicity and effectiveness. The first step is S, for smile. Ask the person to smile. In a healthy individual, both sides of the face should move symmetrically, but if one side of the face droops or appears weaker, this is a clear sign that the facial muscles are not responding properly, an early indicator of a stroke. A lopsided smile is a powerful visual clue that something is wrong. Next is A for arms. Ask the person to raise both arms in front of them. In a normal situation, both arms should rise to the same level and stay there. But if one arm drifts downward, appears weak, or cannot be lifted at all, this is another strong warning sign. The affected arm may feel heavy or difficult to control, a clear signal that one side of the body is being affected by a stroke. The third step is M for music. But it's not just about music. It's about speech. Ask the person to say a simple sentence, such as, "The sky is blue." Listen carefully to how they speak. If their speech is slurred, difficult to understand, or completely confused, this is a major red flag. Difficulty speaking, slurred speech, or using the wrong words are all signs that the part of the brain responsible for language has been compromised. Finally, U for urgency. If any of these signs are present, immediate action is required. Do not waste time questioning the symptoms. Call 911 immediately, or take the person to the nearest emergency room. In the case of a stroke, time is brain. Every minute without treatment means more brain cells are lost. According to the American Stroke Association, recognizing a stroke and getting medical help quickly can significantly reduce the damage it causes and improve the chances of recovery. The beauty of the SAMU method is its simplicity. It does not require any medical equipment, special skills, or complex knowledge. Anyone can use it. Whether you are at home, in a public place, or even on a phone call with someone who might be having a stroke, this method transforms an overwhelming medical emergency into a situation where anyone can take action. The faster a stroke is recognized, the faster treatment can begin, and the better the outcome. Remember SAMU's smile, arms, music, and urgency. Knowing these 4 simple steps could save a life. Stroke doesn't happen without a cause. In fact, it is often the result of a combination of risk factors that build up over time, many of which can be controlled. Understanding these risk factors is essential for prevention, especially for seniors. Among them, high blood pressure stands as the most significant, known as the silent killer. High blood pressure places immense stress on the walls of the arteries, including those that supply the brain. Over time, this constant pressure can weaken the artery walls, making them more prone to rupture, which can lead to a hemorrhagic stroke. It can also cause plaque buildup, narrowing the arteries, and reducing blood flow, setting the stage for an ischemic stroke. According to the Centers for Disease Control and Prevention, CDC, nearly half of American adults have high blood pressure, but many are unaware of it because it often has no symptoms until it is too late. Diabetes is another major contributor to stroke risk. This condition not only affects blood sugar levels, but also damages blood vessels throughout the body. Elevated blood sugar can cause the arteries to become thickened and less flexible, a condition known as atherosclerosis. This not only increases the risk of blood clots forming, but also makes it easier for a clot to block an artery in the brain. Seniors with diabetes are at a particularly high risk, and managing blood sugar levels is crucial in reducing that risk. Smoking is another factor that dramatically increases the risk of stroke. Tobacco smoke contains thousands of chemicals, many of which directly damage the lining of blood vessels. Nicotine raises blood pressure, while carbon monoxide reduces the amount of oxygen that blood can carry. Over time, smoking accelerates the buildup of fatty plaques in the arteries, narrowing them and making them more likely to become blocked. The American Heart Association notes that smokers are twice as likely to have a stroke compared to non-smokers. But the good news is that quitting smoking can begin to reverse this damage almost immediately. Heart rhythm disorders, particularly atrial fibrillation, AFib, are another serious risk factor. AFib causes the heart to beat irregularly, which can lead to the formation of blood clots. These clots can travel through the bloodstream and lodge in an artery in the brain, causing an ischemic stroke. Seniors are particularly susceptible to AFib, with the CDC reporting that 1 in 10 people over the age of 80 has this condition. Regular checkups to monitor heart rhythm and appropriate treatment can greatly reduce the risk of stroke. Excess weight and a sedentary lifestyle are also major contributors. Obesity puts extra strain on the entire cardiovascular system, increasing blood pressure and making it harder for the heart to pump effectively. A lack of physical activity further increases the risk, as it contributes to poor circulation, weight gain, and the development of other risk factors such as diabetes and high cholesterol. According to the CDC, less than a quarter of American adults meet the recommended amount of physical activity each week, making this a widespread problem. An unhealthy diet is another key factor. Diets high in saturated fats, trans fats, cholesterol, and salt can contribute to high blood pressure, high cholesterol, and obesity, all of which increase stroke risk. Conversely, a diet rich in fruits, vegetables, whole grains, and lean proteins can help protect against stroke. For seniors, maintaining a balanced diet is crucial, as poor nutrition can also weaken the immune system and overall health. Family history also plays a role. If a close relative, such as a parent or sibling, has had a stroke, the risk is significantly higher. This is partly due to genetic factors that may make an individual more prone to high blood pressure, diabetes, or other conditions that increase stroke risk. However, while you cannot change your genetics, understanding your family history can help you be more vigilant about prevention. The good news is that many of these risk factors can be controlled. Monitoring blood pressure, maintaining a healthy weight, staying active, avoiding tobacco, controlling diabetes, and eating a balanced diet can all significantly reduce the risk of stroke. Knowing these risk factors is the first step, but taking action to address them is what truly makes a difference. Preventing stroke, especially for seniors, is not just about avoiding a single trigger. It's about adopting a comprehensive, healthy lifestyle. One of the most critical factors in stroke prevention is maintaining stable blood pressure. High blood pressure, often called the silent killer, is the leading cause of stroke, yet many people are unaware they have it. Regular monitoring is essential. Seniors should check their blood pressure at least once a month or more frequently if they have a history of hypertension. Medication prescribed by a healthcare provider should be taken exactly as directed, and lifestyle changes should support those efforts. Reducing salt intake, avoiding processed foods, and opting for low-sodium alternatives can significantly help maintain a healthy blood pressure. A balanced diet is another cornerstone of stroke prevention. For seniors, this means focusing on nutrient-rich foods that protect the heart and brain. Fruits and vegetables are packed with vitamins, minerals, and antioxidants that reduce inflammation and improve blood vessel health. Whole grains, like oatmeal, brown rice, and whole wheat bread, provide fiber that helps maintain healthy cholesterol levels. Lean proteins, such as fish, chicken, beans, and nuts, supply essential nutrients without the unhealthy fats found in red meat or processed foods. It is also crucial to limit sugar intake, which not only helps control weight, but also reduces the risk of diabetes, a significant stroke risk factor. Seniors should aim to fill half their plate with vegetables and fruits, a quarter with whole grains, and the remaining quarter with lean protein. Regular physical activity is equally important. For older adults, this doesn't mean intense workouts, but rather consistent, moderate exercise. Walking for 30 minutes a day, at least 5 days a week, can dramatically reduce the risk of stroke. Physical activity helps maintain healthy blood pressure, improves circulation, and keeps weight in check. For those with mobility issues, chair exercises, gentle yoga, or water aerobics can be excellent options. Exercise also boosts mood and reduces stress, which is another indirect way of lowering stroke risk. Controlling blood sugar and cholesterol is also critical, especially for seniors with diabetes. High blood sugar can damage blood vessels over time, making them more likely to become blocked, leading to a stroke. Regular checkups are essential for monitoring blood sugar levels, and medications should be taken as prescribed. A diet low in sugary foods and beverages is also vital. Similarly, cholesterol levels should be checked regularly. If they are too high, dietary adjustments, such as reducing saturated fat intake and choosing healthier oils, along with prescribed medication, can help maintain healthy levels. Another essential step in stroke prevention is quitting smoking. Smoking directly damages the arteries, making them more prone to blockages. It also raises blood pressure and decreases oxygen levels in the blood, increasing the heart's workload. For seniors who have smoked for decades, quitting may seem challenging, but it is never too late. The benefits of quitting begin almost immediately. Within weeks, circulation improves, and within months, the risk of stroke starts to decrease. Support groups, nicotine replacement therapy, and counseling can all make quitting easier. Limiting alcohol is also important. While moderate alcohol consumption may offer some heart benefits, excessive drinking has the opposite effect. It raises blood pressure, contributes to obesity, and can lead to irregular heart rhythms, all of which increase stroke risk. For seniors, moderation means no more than 1 drink per day, and ideally, even less. If alcohol is part of social activities, choosing lower alcohol options or substituting with non-alcoholic beverages can be a healthier choice. Stress management is another critical aspect of stroke prevention. Chronic stress can raise blood pressure, disrupt sleep, and lead to unhealthy habits like overeating or smoking. Seniors should explore stress reduction techniques such as meditation, deep breathing exercises, Tai Chi, or gentle yoga. Spending time with friends and family, engaging in hobbies, or even walking in nature can all be powerful stress relievers. It is also essential to maintain a good sleep routine, aiming for 7-8 hours of quality sleep per night, as poor sleep is linked to higher stroke risk. Regular health checkups are also a vital part of stroke prevention. Seniors should see their healthcare provider for routine blood pressure checks, cholesterol and blood sugar tests, and heart rhythm assessments. Annual eye exams are also essential, as changes in vision can be an early sign of vascular problems. Regular dental visits can help detect signs of poor circulation, such as gum disease, which has been linked to cardiovascular risk. Staying proactive with health screenings means that potential problems can be caught early, before they become life-threatening. Finally, education and awareness are key. Understanding what stroke is, recognizing its early signs, and knowing the personal risk factors are all part of effective prevention. Family members and caregivers should also be informed, as they may be the first to notice subtle changes in a senior's behavior or speech. Preventing stroke is not about a single action. It is a lifelong commitment to maintaining health. But with the right knowledge and proactive habits, the risk of stroke can be significantly reduced. Recognizing the early signs of stroke is not just important, it is life-saving. Remember the 7 critical signs: sudden loss of speech, or slurred speech, sudden dizziness or loss of balance, an intense and sudden headache, numbness or weakness on one side of the body, difficulty speaking or understanding speech, sudden vision loss and sudden fainting. These are not just symptoms, they are urgent warnings from your body. A stroke can strike without warning, but it doesn't have to end in tragedy. Knowing these signs means you can act fast, getting medical help when it matters most. Every second counts, because the faster a stroke is treated, the greater the chances of recovery. For seniors, this knowledge is even more crucial, as they are at higher risk. But it is not just about protecting yourself. It is about protecting your loved ones too. If you found this video helpful, please give it a thumbs up and share it with your friends and family. You never know, what you share today might save a life tomorrow. And if you want to stay informed about more health tips for seniors, don't forget to subscribe to our channel. Make sure you turn on the notification bell so you never miss an update. Stay healthy, stay informed, and thank you for watching.